Vitamin B complex. A review. Overview. The vitamin B complex is a group of water soluble vitamins that play vital roles in cell metabolism, energy production, and overall body function. These vitamins are essential for maintaining good health and are involved in a wide range of metabolic processes, including the conversion of food into energy, DNA synthesis, and the health of skin, nerves, and blood cells. Composition of the vitamin B complex. The vitamin B complex includes the following vitamins. 1. Vitamin B1, thiamine, essential for carbohydrate metabolism and nerve function. It plays a critical role in converting glucose into energy and is involved in nerve signaling. Thiamine deficiency can lead to beriberi and Wernicke-Korsakoff syndrome, particularly in alcoholics. 2. Vitamin B2, riboflavin, acts as a coenzyme in various oxidation reduction reactions, including energy production and cellular respiration. It is important for maintaining healthy skin and vision. Deficiency can cause araboflavinosis, characterized by sore throat, swelling of mucous membranes, and cracks around the mouth. 3. Vitamin B3, niacin, involved in energy production, DNA repair, and the synthesis of fatty acids and cholesterol. Niacin is essential for the conversion of food into glucose. Pellagra, a deficiency in niacin, presents with dermatitis, diarrhea, and dementia. 4. Vitamin B5, pantothenic acid, integral to the synthesis of coenzyme A, CoA, and is involved in the metabolism of fats, proteins, and carbohydrates. It plays a role in the synthesis of neurotransmitters and steroid hormones. Deficiency is rare but can cause symptoms like fatigue, irritability, and digestive disturbances. 5. Vitamin B6, pyridoxine, important for amino acid metabolism, neurotransmitter synthesis, e.g., serotonin, dopamine, and the production of hemoglobin. It also aids in the conversion of tryptophan to niacin. Deficiency can cause anemia, dermatitis, depression, and confusion. 6. Vitamin B7, biotin, functions as a coenzyme in carboxylation reactions, important for fatty acid synthesis and glucose production. It is also crucial for maintaining healthy hair, skin, and nails. Biotin deficiency, though rare, can lead to hair loss, skin rashes, and neurological symptoms. 7. Vitamin B9, folate folic acid, essential for DNA synthesis, repair, and methylation. It is particularly important during periods of rapid cell division, such as pregnancy and fetal development. Folate deficiency can cause megaloblastic anemia and neural tube defects in developing fetuses. 8. Vitamin B12, cobalamin, plays a vital role in nerve function, red blood cell formation, and DNA synthesis. It also helps in the metabolism of fatty acids and amino acids. Deficiency can cause pernicious anemia, neurological symptoms, and irreversible nerve damage if not treated. Sources of vitamin B complex. The B vitamins are primarily found in a variety of foods, including whole grains, cereals and bread, meat, poultry, and fish, eggs and dairy products, leafy green vegetables, nuts, seeds, and legumes. Some individuals, especially vegetarians, vegans, and the elderly, may need supplements, particularly for B12, as it is mainly found in animal products. Clinical significance and deficiency. Vitamin B complex deficiencies can lead to a variety of clinical conditions, each corresponding to a deficiency in a specific B vitamin. Thiamine deficiency, Wernicke-Korsakoff syndrome, beriberi, riboflavin deficiency, araboflavinosis, niacin deficiency, pellagra, pyridoxine deficiency, anemia, neuropathy, biotin deficiency, hair loss, neurological symptoms, folate deficiency, megaloblastic anemia, birth defects, cobalamin deficiency, pernicious anemia, neurological disorders. Recommended daily allowances, RDA. The RDA for B vitamins varies by age, gender, and life stage, e.g., pregnancy. Below are general guidelines. B1, thiamine, 1.1 to 1.2 milligrams per day. B2, riboflavin, 1.1.3 milligrams per day. B3, niacin, 14 to 16 milligrams per day. B5, pantothenic acid, 5 milligrams per day. B6, pyridoxine, 1.32 milligrams per day. B7, biotin, 30 milligrams per day. B9, folate, 400 milligrams per day, 600 mesograms for pregnant women. B12, cobalamin, 2.4 milligrams per day. Supplementation and safety. Vitamin B complex supplements are often recommended for individuals who are at risk of deficiency, such as older adults, pregnant women, and people with certain health conditions like celiac disease, Crohn's disease, or chronic alcohol use. While most B vitamins have a low risk of toxicity because they are water soluble and excreted in the urine, high doses of certain B vitamins, e.g., B6 and niacin, can cause adverse effects such as neuropathy or liver damage. Conclusion: the vitamin B complex plays a crucial role in maintaining metabolic functions, energy production, and overall health. A balanced diet can typically provide all the necessary B vitamins, but certain groups may benefit from targeted supplementation. Recognizing the symptoms of deficiency and understanding the roles of each B vitamin can help in managing health and preventing related disorders. Vitamins B4, B8, B10, and B11 are often less known because they are not universally classified as part of the essential B complex vitamins. Some of these substances were once considered vitamins but were later reclassified when it was found that they could be synthesized by the body or were not essential for human nutrition. Here's a brief overview of each. 1. Vitamin B4, adenine. Function: adenine is a component of nucleotides, which are building blocks of DNA and RNA. It plays a role in cellular energy transfer as a part of ATP, adenosine triphosphate, and helps in protein synthesis. Status: not considered an essential vitamin because it can be synthesized by the body. Sources: found in various food sources such as meat, dairy, grains, and vegetables. Reclassification: it is no longer classified as a vitamin because it is not required in the diet, as the body can produce it adequately. 2. Vitamin B8, inositol. Function: inositol is involved in the structural function of cell membranes and acts as a signaling molecule in the brain and nervous system. It plays a role in the regulation of insulin, affecting blood sugar control, and is thought to be beneficial for mental health conditions like anxiety and depression. Status: while inositol was once considered a vitamin, it is no longer classified as such because the body can produce it from glucose. Sources: found in fruits, especially citrus, whole grains, nuts, and beans. Clinical use: it is sometimes used as a supplement, particularly in the treatment of polycystic ovary syndrome, PCOS, and for supporting mental health. Vitamin B10, para-aminobenzoic acid, PA. Function: PABA is involved in the synthesis of folic acid in microorganisms. In humans, it has been used topically as a sunscreen in the past due to its UV blocking properties. It may also have a role in skin and hair health. Status: not classified as an essential vitamin for humans because the human body does not require it for survival. It is, however, essential for certain bacteria. Sources: found in foods like whole grains, liver, eggs, and yeast. Supplementation: PA-based supplements are available, but their use is limited and often directed towards skin care. 4. Vitamin B11, folic acid, folate in some regions. Function: in some regions, particularly in Europe, B11 is used interchangeably with folic acid, vitamin B9. It is essential for DNA synthesis, repair, and cell division, especially during periods of rapid growth such as pregnancy and fetal development. Status: typically classified as vitamin B9 in most vitamin nomenclatures, though it may be referred to as B11 in some countries. Sources: leafy green vegetables, legumes, liver, and fortified grains. Clinical use: folic acid supplements are widely used to prevent neural tube defects during pregnancy. Summary: vitamins B4, B8, B10, and B11 have had varied classifications over time. B4, adenine, and B10, ABA, are not considered essential for human nutrition, while B8, inositol, is often supplemented for specific health benefits, but is not considered an essential vitamin. B11 generally refers to folate, B9, and is an essential vitamin under that classification. The reclassification of these compounds away from the B vitamin group typically reflects a deeper understanding of their roles and the body's ability to synthesize them. Amygdalin, vitamin B17, fact or myth? Amygdalin, often referred to as vitamin B17, is a controversial substance that is not officially recognized as a vitamin. While it is sometimes called a vitamin, this is misleading because it does not meet the criteria to be classified as an essential vitamin. Here's a closer look at what amygdalin is, its history, and why it is often surrounded by controversy. What is amygdalin? Amygdalin is a naturally occurring compound found in the seeds of certain fruits, such as apricots, peaches, apples, cherries, and plums. It is also present in bitter almonds. Chemically, amygdalin is a cyanogenic glycoside meaning it can release hydrogen cyanide when metabolized by the body. This can potentially be toxic, as cyanide is a known poison that can interfere with cellular respiration. The origins of the term vitamin B17. The term vitamin B17 was popularized in the 1950s by Ernst T. Krebs Jr., who promoted a purified form of amygdalin called laetrile as a treatment for cancer. He argued that laetrile, derived from amygdalin, was a vitamin and that cancer was a form of deficiency that could be treated with this vitamin. This term, however, is not scientifically accepted. The American Medical Association, AMA, National Cancer Institute, NCI, and Food and Drug Administration, FDA, have all concluded that amygdalin does not fulfill the criteria to be considered a vitamin. Controversies surrounding amygdalin laetrile. Claims. Proponents of laetrile claim that it has anti-cancer properties, suggesting that it selectively kills cancer cells while leaving healthy cells unharmed. Some believe that the cyanide released from amygdalin targets cancer cells specifically. Scientific evidence. Extensive studies have shown no reliable evidence that laetrile or amygdalin is effective in treating cancer. Clinical trials conducted by reputable institutions like the NCI have found no significant benefits in patients who used laetrile as an anti-cancer therapy. Risks. Because amygdalin can release cyanide in the body, its use carries serious risks, including cyanide poisoning. Symptoms of poisoning can include headache, dizziness, confusion, liver damage, and, in severe cases, death. Status in medicine, lack of recognition. Amygdalin is not recognized as an essential vitamin by any major medical or nutritional body. The term vitamin B17 is considered a misnomer. Regulation. Laetrile and amygdalin products are banned or highly regulated in many countries, including the United States, due to their toxicity and lack of proven efficacy. Why it's not a vitamin. Definition of a vitamin. Vitamins are organic compounds that are essential for normal physiological functions, but cannot be synthesized in sufficient quantities by the body. They are required from the diet to prevent deficiency-related diseases. Amygdalin's role. Amygdalin does not play an essential role in human metabolism, and no deficiency condition has been identified that would require it for health. This disqualifies it from being classified as a true vitamin. Conclusion. Myth over fact. Amygdalin laetrile as a cancer cure has been scientifically debunked, and it poses significant health risks. The use of the term vitamin B17 is a myth without a basis in scientific evidence. It persists mainly due to alternative medicine advocates, but it lacks support from the mainstream medical and scientific communities. For those interested in natural remedies or supplements, it is important to rely on substances that have been thoroughly researched and approved by medical authorities to ensure both safety and efficacy.